We have breaking news for you this hour. The Vatican says Pope Francis has a respiratory infection and will need to spend a few days in hospital. They say the 86-year-old had complained of breathing difficulties in recent days. For more on this, let's bring in the CBC's Sarah Galashan. Sarah, what's the latest that you know?
Well, what we're hearing from the statement coming from the Vatican is that Pope Francis is going to be undergoing a few days of what they're calling appropriate medical therapy at Gemelli Hospital, where he had gone to have tests done, as you pointed out, after suffering some difficulty breathing in the last few days. They're at pains to point out that while a respiratory infection has been detected, it is not COVID related. But given what was detected, it has been determined that he does need to be in hospital for, as I say, a few days of appropriate hospital medical therapy. Just earlier today, Wednesday morning, he did preside over his regularly scheduled weekly general audience at St. Peter's Square. There are reports of those who noticed that he did seem to experience a bit of pain when leaving, getting into his vehicle. According to the BBC, among those staying with him at the hospital, at least for the night, is expected to be his very closest staff, and among those included in that would be security as well. Hannah?
Sarah, what else do we know about his recent health issues?
Health-wise, the Pope has experienced some problems affecting his knee, and that has recently made mobility difficult for him and forced him to use a wheelchair. 2021, he did have surgery to treat a colon problem, and earlier this year in January, he revealed that problem had returned. Nevertheless, though, he has maintained up until recently as February, he's been maintaining a pretty active schedule. He's been traveling abroad. He made 2 trips in February, one to the Democratic Republic of Congo and to South Sudan. In January, he led the funeral procession for his predecessor, Pope Benedict, which, of course, we need to remember here, Pope Benedict was the first pope in centuries to voluntarily step down from the position, and he cited his poor health for the reason. Previously, Pope Francis has indicated that he may wish to follow in his predecessor's footsteps should his health become an issue, should his health start to fail. And so really for that reason, I mean, all eyes are always, on the Vatican in Rome. But given that he had indicated that previously, that makes this story of his health, all the more poignant, and why we watch it so closely. And of course, we are entering into what is a very busy season. The lead up to Easter, generally a very busy time for the Pope.
Yeah, Sarah, thank you. And Sarah will continue to bring you all the breaking news on the Pope's condition as it develops.